We are live.
Welcome to the COVID313 Coalition for Families and Students. We're translating the town hall today into Spanish and ASL. So we want to give folks time to get on the right line and get comfortable. Ophelia or Rita, who is going to give us the Spanish instructions today?
En español, visite la página de Facebook de Detroit Hispanic Development Corporation.
Thank you so much, Rita. And then Katie, could you please provide, oh, sorry, it's Julie. Hi, Julie. Could you please provide the instructions for ASL? Thank you so much, Julie. It's so great to see you again today. So we want to welcome all of you that join us every week back to our town hall. And for those of you that are just joining us for the first time today, let us know where you're joining us from. And you can do that by putting your answer in the Facebook chat, or you can text us at 313, and I don't have this number memorized. Molly, could you help me here on what the what our text number is again? We'll wait for Molly to come back. But so you can put your questions and comments in the chat. We really want to hear from you. Please remember that this town hall is really a two-way conversation. So we have some excellent guests with us today, but we also want to hear from you, and they want to hear from you, and they want to hear what you're thinking, and also the most pressing questions that you have. And the text number, if you can't chat in Facebook, is 313-288-2082. Again, that number is 313-288-2082. And so I am so excited because today we are joined by Larry Simmons, Reverend Larry Simmons. But I'm really excited because Jametta Lilly, who has been gone for what it feels like in COVID time, months. Yeah. I'm sure it has not been months, but it feels like months. Jametta is back, and she's back on such a important day. In reflecting on what just happened in the Derek Chauvin trial. And so I'm going to hand it over to Jametta Lilly and Reverend Simmons, who are going to be our first voices of the town hall today. Thank you both.
Brother Larry, I want to just for a moment let everyone know, thank you so much, Christine. I come here humble and grateful and joyful to return to you on this really momentous day. And I want to defer to the spirit that I know that Reverend Larry Simmons shared this morning to share it with you. Larry, if you would, take us forward with your thoughts as we think about this monumental point, this inflection that we are experiencing in the midst of our nation.
Hello, how's everybody? It's been a minute since I've been in front of you to share. I've been watching as our coalition continues to grow and do well. And that coalition and the thought of that coalition is what prompts my remarks today about the conviction of Derek Chauvin for the murder of George Floyd. You know, I have heard some people say that this is not a victory and we should be focused on the next trials and other things. And I absolutely agree. The struggle is not over, it continues. But I think it's important for us to acknowledge at this moment that the conviction of Derek Chauvin is the result of generations of activists like you who believe in justice. Generations of people who have given their lives to fighting for this. Generations like Sylvia Mendez, a Mexican Puerto Rican whose landmark case in California in 1946 desegregated schools in California, which set the stage for Brown versus Board of Education at the Supreme Court, which desegregated and outlawed segregation in the country. Those activists have gone on to the next life, but their work serves as a foundation for what we've done. Yuri Ichikawa, he coined the phrase along with his wife, Asian Americans, and founded the Asian American Pacific Organization. These activists, these folk who go way back, Ida B. Wells and Susan Anthony with the women's movement, these generations of people, many of whose names we'll never know, all lined up and grabbed the chain of history and pulled it toward justice. I just want to acknowledge today that this is a moment. When Brown versus Board of Education was passed, every school in the United States did not desegregate. But here we are now today, and that is the policy across this country. It may not yet be the fact, but it is certainly the policy. And so you can no longer exclude students on the basis of their race. I just want to celebrate this moment and thank you all, because you are part of that maybe unnamed group of activists who work just where you are, who've exercised your personal power and gathered with some others for collective action. And it is that work that causes us to make the statement that history is long, but it bends, the arc of history is long, but it bends towards justice. It doesn't bend by itself. It bends because you and our predecessors wrapped that chain around history, and the activists in a unified voice said, we will have justice, and yanked it to its encounter with history. Justice comes to history because you and the activists before you have brought it there. And so out of those ancient voices, there's a loud cry going up, echoing through time. Black lives matter. Thank you all today and all who've come before us. Black lives matter. Black lives
matter. Black lives matter. And Reverend Larry, thank you for reminding us that every single victory that we have ever had has not become from the benevolence of those who oppress us, but in fact from the focus and vigor and the spirit and the action that comes from all of you and our ancestors. So we're at this wonderful moment of witnessing the power of collective action. And if I may, I want to share with us as we think about the work ahead, that there are two people that I think that are interesting in our discussion. One is the Asante, which is one of the larger tribes out of Ghana in West Africa, has a saying, each on top of the other. And it speaks to what was just shared with us, was this notion of legacy, this notion of carrying our values of action to create the change that we want. And like our wonderful sister and dynamic sister, Stacey Abrams in Georgia has reminded us, we are the new majority. Black people, Latinx, other people of color, and progressive whites working together, pulling on that chain that was just discussed of the struggles that have gone on in this country, certainly for 400 plus years, as well as internationally, we can and have made a difference. So yes, I can breathe a little better today because a slight piece of justice was rendered earlier this week in regard to our brother Floyd. George Floyd is one of many. And we all know that. So make sure, generations, young people, family, we must stay vigilant and we must stay focused. And the joy that I have is to return to this program. Again, my name is Jametta Lilly. I'm blessed to serve as the CEO of the Detroit Parent Network and to be a part of this marvelous coalition that makes it a point every week since the pandemic started to bring information, resources, and gives voice to the community and experts to work together for the change that we know that our community needs and to keep us safe through COVID. As we get ready to go into the program today, not only are we always going to have the voices of our experts in health and mental health, and also addressing basic needs, today, some of you know, is Earth Day. And that's more than ever, we're recognizing the importance. There's only one place we as human beings are, and that's on the planet Earth. And so we have to be very cognizant and focus on climate change, and even understand that the United States government, most recently, in fact, I thought it was remarkable. If you look at not only the kinds of exposés that are coming from the FBI, CIA, the Defense Department, as they are identifying what are the greatest threats in the United States. In addition to the threat of white supremacy and terrorism on that faction, in addition to what's often thought of as being international intrigue and terrorism, climate change is now being identified as perhaps the top threat to the population, not only of the United States, but the world. And so there's an intersection that we're going to explore, that the reality is that the structural racism that has existed and how it impacts the earth, the environmental racism that we have experienced in this nation, whether it is affecting our asthma, whether it affects other bronchial problems, whether it affects cancer, all of this environmental injustice has created the health disparities that have made Black and Brown and other communities more vulnerable to COVID. So we're going to connect those dots. Environmental racism equals poor health, and poor health means that we are less able and capable in our bodies to be able to fight back against COVID. So we've got a lot of great intersections to explore. And let's jump into what is going to be another dynamic presentation. And to help us through this work, I'm really excited that we have Rajesh Rivatia, who is part of our team and who is a marvelous director working with GVSU around issues of charters and education. Today, she's going to continue the conversation with health and talking to representatives from the Asian community, specifically Sikh. And as we understand right now in this point in time, that not only have some groups always been marginalized and attacked, but we see increases in that. Rajesh, would you come forward and introduce our speaker? And let's have a conversation about the impacts. Thank you.
Absolutely, Jametta, it's wonderful to have you back. Missed your bright smile. Thank you so much. As Jametta said, I'm Rajesh Rivatia. I am the Deputy Director for School Performance for Grand Valley Charter Schools Office. And I am very honored to bring to you today Representative Rajesh Puri. He is a first-term representative from the 21st House District, which covers Canton, Belleville, and Van Buren Township. He also serves as the Assistant Democratic Whip. As a child of immigrants, he is also the first elected Sikh American in the Michigan legislature and the first person of color to hold his seat. He has been very active, and we're excited to have you here, Representative Puri. Thank you so much for joining us. I know that you are actively in session, so we want to make that the best use of your time. So let's just get into some of the questions. Would love to hear from you a little bit about, this last incident of Asian American hate happened in Indianapolis, and it was the shooting at the FedEx facility. Could you please share a little bit about what exactly happened and how the Sikh community was impacted?
Yes, just before we start, again, thank you for having me. This is some really important conversations we're having today, so I'm just really happy to be a part of this. But, what happened in Indianapolis was something that happens far too much in our country, and that was yet another mass shooting, roughly, I think, the 50th of this month alone within our country. It was an ex-employee going into his former workplace, someone with documented mental health issues, who had been reported to the authorities by his own mother, but with all of that was still able to procure an assault rifle, walked into this facility, which primarily employs Sikh Americans in the metro Indianapolis area. And so the shooter knew exactly who he was targeting. And this is just concerning because the Sikh American community has been, victim to hate and violence many times before. Gun violence, unfortunately, plagues all communities in our country, and the Sikh community, unfortunately, is victim to that as well.
Thank you. Many of our viewers may not have experience with the Sikh community, even though there's a large presence of Sikh Americans. Can you tell us a little bit about the community, and how would we be able to identify someone who is a member of the Sikh community?
Yes, no, thank you for the question. So the Sikh community is a religious minority. It originates from northern India, but Sikhs actually first started immigrating to the States back in the early 1900s, and were some of the first South Asians to come over to the country. It's estimated that anywhere between 500,000 and 1 million Sikh Americans reside across the country, with actually tens of thousands calling Michigan home. And so primarily in southeastern Michigan, Michigan is actually home to roughly 15 or 20 Sikh gurdwaras, or places of worship. And Sikhs are generally identifiable by their turbans and long beards. And really the fact is if you see someone wearing a turban in America, there's a 99% chance they are a Sikh American.
Representative, do you think that is partially why Sikhs are targeted? Because they're easily identifiable?
Yeah, I mean, I think that, the identity issues are absolutely a part of it. I think there's a lot to unpack as to why Sikhs are targeted. As I mentioned before, for starters, we have a gun violence epidemic here. All of the mass shootings we're talking about involved an assault rifle. And so it's very likely that many of the lives that were lost in these tragedies could have been saved if we could have kept those assault weapons out of the killer's hands. But another big piece of it is identity. I mean, the commonality of a beard and turban, to perceived terror groups, especially after 9/11, has propelled Islamophobia and xenophobia. And so, obviously no community deserves to live in fear, but we must find a way to just educate our broader communities and just start to appreciate all of the diversity around us.
Thank you. You, in your short time as an elected official, have taken a strong position to represent marginalized communities and lift up the values of diversity, equity, and inclusion. Can you share with us a little bit about what you've done and what you foresee coming next?
Yeah, it's funny because people always tell me you take a strong position, and I'm honestly just doing what I deem that all of us should be doing. It's important for me to use my platform for good. I truly feel that our diversity is what makes us different. It is our biggest strength. Unfortunately, as of recent, I've had to be very vocal in calling out the spike of hate crimes happening around the country. I introduced a resolution to condemn the hate crimes against the Asian community. There's been a tremendous hike since the onset of COVID. The Chinese, Korean, and Vietnamese communities have unfortunately had to bear the brunt of that. But I've talked to Asian parents in my district, which is one of the most rapidly diversifying districts in the entire state of Michigan. And they're absolutely terrified. They're choosing not to send their kids back to in-person learning, even if they're given the option, out of the fear of verbal and physical abuse. I also issued a resolution to make April Sikh Awareness Month here in Michigan, because I truly believe that we must start having just very intentional conversations and lifting the voice of each marginalized community to move our society to a place in which everyone is welcome. I've also been involved in a number of diversity and inclusion efforts within the state legislature to ensure that just potential legislation that is coming is more inclusive, and that systemic bias and racism is starting to be broken down. And so I just think.
I'm sorry, Representative.
Yeah.
So this is wonderful. Please forgive me for jumping in, also Rajesh, but we have a couple of people that are really asking if you might slow down just a tad, because you're saying such important things, and our interpreters are trying to make sure that they're capturing all of what you're saying. Thank you.
Yeah, sorry, I get excited. I was,
I do the same. Don't worry.
I'm on the House floor here, so I was just trying to sneak this in before the votes start. But I'm sorry, I'll slow it down here. But I guess just overall, what I was just saying there is that we must be just more intentional in our efforts to start to break down these kind of systemic barriers that do exist.
Thank you. Recently, and you've alluded to this, Reverend Simmons alluded, and Jametta talked about this. We have seen a wave of actions that have hurt people of color specifically. We saw some accountability earlier this week and given some hope, but we still have a long way to go. There are literally thousands of children of color who watch the news and hear every day about someone who looks like them being shot or killed or targeted, and who live in fear that it could happen to them. What hope do you offer these children, or do you offer your own children after this tragic event that impacted your community, to help them cope and not live in fear?
You're absolutely right. We have a long way to go. There's still a tremendous amount of change that's still absolutely needed. I think, unfortunately, for starters, we must admit that we must follow the intuition of our children. Our children have every right to be scared right now. Our country has a gun violence epidemic with more mass shootings than every other major country combined. Our country has a systemic racism and bias issue, right? And so if George Floyd's murder was not captured on an iPhone by an innocent bystander, I'm not sure we're having the same conversation today. And so, I understand I'm painting a very doomsday picture here, but I do want to leave you with this. Like, as you mentioned, I'm a father. I have 2 small boys, and a lot of times, people ask me what's the best thing about being a parent, and undoubtedly for me, one of the greatest things is the ability to relive life through the innocent eyes of my children. And so we went to a playground next to our house a couple months ago, and my oldest was about 4 years old at the time, and there was 9 or 10 children playing of all different backgrounds, and they're all at the playground. And so these 9 or 10 kids were playing, but there was only one slide, and all of the kids wanted to go down the slide. But you know what? These 4-year-olds figured it out. They didn't have to have diversity and inclusion issues, right? They didn't say only kids that look a certain way are allowed down the slide. They all got in line. They took a turn, got back in line, and took another turn, right? And so I truly believe that hate and ignorance is taught, right? And we can learn from our 4-year-olds that us as adults can complicate things which should be very easy to figure out. And I truly hope that we can start to appreciate the diversity around us, to start seeing it as our greatest strength. And so just, I think we can actually learn from our kids.
Thank you so much. That is so poignant. And you're absolutely right that sometimes we need to look to our youth to find the guidance, and appreciate your bringing that to the forefront. We sincerely appreciate your being here. Is there anything else you'd like to share with our audience before we release you and let you get back to work governing the state of Michigan?
Well, I do appreciate the opportunity to be here, and thank you for your flexibility. For anyone who is interested in learning more about just the Sikh culture, there's a number of resources available online. One group is called the Sikh Coalition. Another is SALDEF. They both have just one-pagers just to help anyone who is interested to learn more. And then obviously, you can always feel free to contact me, and I'd love to take anyone's questions. But thanks again for the opportunity.
Thank you so much for being here. We appreciate it. Take care.
Thank you. Bye-bye.
Bye-bye.
Thank you so much. Appreciate that. And Rajesh, thank you. It was really important to have someone from the legislature. And I think it was very important for people to begin to understand when we use this word like Asian, that's a huge term. And people need to understand that there are nationalities, there are ethnicities, there are different religions. And as we have a tendency to do in this country, we lump people and we respond to them accordingly. So we have wonderful opportunities to learn more about each other so we can build the kind of just society that we want. Thank you. We're going to move forward, and we want to make sure that we are always focusing in on health. And to bring us up to date, let's not delude ourselves. We are 13 months into COVID. We have been on a roller coaster, and we've just had some significant increases in hospitalization, people not remaining vigilant, and people still having real questions about the vaccine. But we're really so proud of the work that our Detroit Health Department has done, and other of us to work on this. So to bring us up on what our statistics look like and what are the connections that we need to make is Hannah. Hannah Ewing is joining us again from the Detroit Health Department. Welcome, Hannah.
Thank you so much for having me. And it's great to see you back on 313.
Yes, it's great to be back. Thank you.
I'm going to start sharing my screen. All right, I'm just going to provide a brief update on what's going on with COVID in the city of Detroit, as well as provide some access points for the vaccination. So this is our current situation in Detroit. If you had this presentation about 5 weeks ago, it would be a very different story. We've had about a 10-fold increase in COVID cases across the city, from about 2.7% 5 to 6 weeks ago to now 20.7%. You're seeing counties like Oakland for being much lower than the city of Detroit. And this is a change. This is the first time they've been having a lower COVID-19 rate from last April. So it's really important that we continue to wear our mask, we continue to wash our hands, and we continue to social distance. We've also seen a spike in the number of confirmed cases. We're now at 44,043 confirmed cases with 1,956 confirmed deaths. So let's talk about some of the reasons why a county like Oakland is having a lower COVID-19 positivity rate. So if you look at the vaccination rate in the city of Detroit, we're sitting at 27.8%. And this is far lower than the state of Michigan, as well as counties in the surrounding area like Oakland and the Outer Wayne community. The Detroit Health Department is trying to work to make it as accessible as possible for you to get the vaccine. But we also realize that education is a part of it, and we want to make sure that you can make an informed decision about getting the vaccine. We realize that these products are new to market, and so you can have lots of questions about it. And however you're feeling about the vaccine, that is completely normal. So let's talk about how immunity works with and without a vaccine. Without a vaccine, your body is exposed to a germ like COVID-19, and you develop symptoms and get sick. And unfortunately, with something like COVID-19, a very healthy person can end up in a hospital on a ventilator or even dead from COVID-19. So the benefit of getting a vaccine is that your body is exposed to what we call the vaccine version of the germ. You get to bypass developing symptoms and getting sick, but you still have the benefits of developing antibodies, and those antibodies are what protect you from an infection in the future. So what is the COVID-19 vaccine and how does it work? Well, the COVID-19 vaccines, the Pfizer and the Moderna vaccine, target a specific antigen. And the antigen they target is what we call the spike protein. And when our body is exposed to that little piece of the mRNA, it is not the live virus. It produces something called antibodies, which when then COVID-19 enters our body, say somebody coughs on us, we're having a conversation with somebody who we don't know is positive, our body can then use those antibodies we have from our vaccine to neutralize the COVID-19 virus and protect us, which is really wonderful. So we don't have to get sick in order to get these antibodies. We can just get them from the vaccine. And what is this little spike protein? So here's a picture of COVID-19. We are very familiar, unfortunately, with it at this point. And what the vaccine produces is not the actual virus, but the little spike proteins in red. And how our body becomes immune from these to COVID-19 is the vaccine works by teaching our cells how to make the same spike protein that is on COVID-19. And the cool thing about these vaccines is that they actually work with our body. Our body only requires the viral genetic blueprint for the COVID-19 spike protein, and then it has its own mechanisms in place to produce this COVID-19 spike protein, which in the end results in those production of antibodies. So that little mRNA is a genetic code that tells cells how to make proteins like antibodies. And mRNA therapies are being used to develop things like personalized cancer treatments, as well as vaccines for infection like the Zika virus. And while the COVID-19 vaccines are relatively new, the technology for messenger ribonucleic acid or mRNA has been around for decades of studies and has been proven with science to be both safe and effective. And it's also important to note that mRNA is not DNA, and it does not have the ability to alter your DNA because it only works in the cytoplasm or the egg white of your cell, and all of your genetic information is housed in the egg yolk or the nucleus of your cell. So we're not making any scrambled eggs here. And if you get a COVID-19 vaccine, these are some side effects you may experience. And the good thing is that they're temporary, they go away, and they're actually signs that the vaccine is working. So you may get something like a headache, tiredness, muscle or joint pain, chills, nausea, vomiting, and fever, but those will go away with time. Here's just a couple of reasons why the vaccine was developed so quickly too. We're talking about good modern science, lots of people working together, just like our community is working together to keep us safe and healthy, lots of volunteers in the clinical trials, a lot of previous research on mRNA vaccines, a lot of money from different funding sources went into these, and then the use of an FDA emergency use authorization, which uses an independent panel of experts to make sure that these vaccines are both safe and effective. So if you're interested in getting vaccinated or you have more questions, come talk to us. If you want to make an appointment at the TCF Center or any of our locations, give us a call at 313-230-0505, Monday through Friday from 9 a.m. to 5 p.m. We also recently opened a nurse line that anyone from the community can come and give us a call, and we can answer any of your questions that you have about getting vaccinated. We have 9 city locations across the city of Detroit, and here are the locations, and I'm also going to put a great link that has all 25 city and the pharmacy locations across the city so that you can pick an option that works for you, both in your location, and say you're familiar with going to a pharmacy and they have it, we welcome you to get your vaccine there. You can also text your address to 313-217-3723 for the 3 nearest vaccine locations, which I think is a really cool tool to use. And as we know, the COVID-19 vaccines are just part of the puzzle to help us get back to normal. We need to continue to socially distance, wash our hands, and wear our face masks to get Detroit back to being Detroit. And here's some additional resources. That nurse hotline is 313-876-4000, and you're going to press the number 3. If you prefer to email us a question, give us an email at dhdoutbreak@detroitmi.gov, and I'll provide all of that information in the chat to be shared.
Hannah, thank you. Thank you as always. Family, you heard it. There are multiple ways that you can connect to get information, and so important to get your shot. That is how we as a city, as a nation, are going to get back to some semblance of normal. So stand up, mask up, get your shot. Thank you, Hannah, for sharing the information with us. We're going to continue our dialogue looking at health. And very often we overlook how important environment is for our health. And as we always have a focus on social and economic justice, we have to look at environmental racism and how that has impacted not only communities of color, but let's be real clear. Memo, there are more poor white folk in this country than there are Black people combined. And poor white folk are also significantly impacted with environmental problems as a result of their poverty. But here to help us really think about its impact here in the city of Detroit, really pleased to have join us from the Michigan Environmental Justice Coalition. We have Teresa Landrum and also Irada Olita. And if I made any mispronunciations, my apologies, and please correct me. But welcome the two of you, and happy to hear whichever you would like to start the conversation. And one of the things we'd like to start with, if I may, is what do you see as the biggest environmental challenges in the city of Detroit?
Okay, all right.
Thank you, Ms. Lilly, for this opportunity to speak to you today. I am Teresa Landrum, and I am from Southwest Detroit, 48217. And in latter years, my community of 48217 has been deemed the most polluted zip code in the state of Michigan. With that being said, to answer your question, what is the biggest challenges we face here in Detroit today is that in Detroit, we are not looking holistically at the environmental justice challenges that we face. We face soil pollution, air pollution, and water pollution. If you look at Detroit, 144 square miles, we know that 65,000 plus parcels of land or areas are considered brownfield. that means that is land that is contaminated. So we have our residents of the city of Detroit living on or near contaminated land. Also, the other challenge that we face, Detroit's history as the automotive capital of the world at one time, we had many, many factories. And in that process, us wanting to be at the forefront of technology in the automotive business, no one considered the pollution that these industries would produce and therefore carry on longevity of illnesses that can be connected to the emissions coming from these factories. And the other challenge that I see here in Detroit is that our own administration is not looking at the areas that need remediation from soil contamination, which has lead, manganese, arsenics, and things that could impact the human health. Here in my area, we have a heavy contamination of soil on former school sites. These schools have been torn down. But before these schools were torn down, our children, myself and my grandchildren, we were playing and exposing ourselves to lead and arsenic from the soil. And that has led to a lot of challenges neurologically and cognitively for our children. So that is one of the biggest challenges that we face, is that we are not addressing the issues of contamination that are impacting the health and cognitive skills of our children and our residents of the city of Detroit.
You just laid it out to us, and I think we have a couple of people, just so folks know. Be sure if you would turn off your audio while you're in the program, with the exception of the speakers. We'd appreciate it. So you really laid out the very nature that we need to look at this holistically, and you make us all shudder when you talk about the fact of what we know is the toxicity that exists not only in the air, but also in our water and in the ground. Can either two of you identify what have been some of the victories that have occurred around environmental justice within the city, maybe in the last 5 years or so?
May I?
Yes, please.
Coming and being involved in the environmental justice movement for more than 25 years, I have to say we've had many victories, small victories, but still we're taking that little hammer and we're chipping down that big mountain. Yeah. Here in Southwest Detroit, we are the host to the only oil refinery that is part of the largest oil refining processing company in the nation, Marathon Oil. In 2019, we experienced in the city of Detroit and across North America, experienced what they called a polar vortex. When that polar vortex happened, there was a crack in what we call a flare, a protective pollution control mechanism. And when that happened, that shut down the operations of Marathon Oil and Air Products, which produces hydrogen to process the oil. And a dangerous chemical was emitted that spanned 40 miles all the way to Mount Clemens, that irritated the eyes, the nose, the ears, the mouth, and even making people nauseated. And some said they went to the hospital, not knowing that this was coming from an oil refinery 40 miles away, which is in my community. So to speed up with that, Marathon was fined for that. And it resulted in a SEP, a supplemental environmental project that Marathon graciously agreed to with EGO and community. This resulted in an air filtration, purification, air conditioning system put on the only public school that we have in our 4821 zip code, which is Mark Twain School, formerly Boynton School. We were ahead of the game because when this happened, unbeknownst to us, we were going to be hit by COVID-19. And in the process of COVID-19 hitting, more African Americans were being impacted, being positive with COVID and suffering large amounts of death in my community and other communities of color. Then we learned from a Harvard study and from a study from European scientists over in Britain that the COVID droplets were riding in on the pollution particles, PM10, PM2.5. In this area, we are in non-attainment for PM matter 2.5 and 10. We're also in non-attainment for ozone and sulfur dioxide, terrible carbon emissions that impact climate change. So,
Teresa, this is powerful information. If I may, we want to get in one more question, and then unfortunately we need to move forward. But I don't want to step over something. You were making the point that the very particles and things that we've been talking about help to exacerbate COVID.
yes.
And I think that's an important question. And we want to make sure that we also have a chance to bring your colleague in on this, Irada, as well. So the last question I have for you is, when we think about what are the things right now that those who are not engaged with you can do to help move forward and make sure that environmental racism and justice is being addressed? Could I get that response from Irada, and then Teresa, if you could wrap us up on that one. Go ahead.
Yeah. Peace, everybody. My name's Irada. I'm with MEJC. I'm a Detroit organizer. And just to answer that question, something that everyday people can do is to find out what's happening in your neighborhood. Reach out to your city council members, reach out to people in your neighborhood, ask your community members, go door to door, see what's happening within with the people that you share community with, because that's how you really start to find out impact. It's not always, you don't always have to be in the front of a picket line, but if you're talking to people in your neighborhood, you kind of know a little bit faster what's happening. You can say, okay, it's weird that everybody in my block has asthma. I wonder why that is. And it makes you, okay, you start to think a little bit more, and now you want to do more research. So I always tell people, do research about your community. You don't have to start with the world, because climate change seems for some people so big, but just start with your neighborhood, start with yourself. What are the things that are affecting you right now? I have intense asthma, so I was very curious about, like, why is it that before I lived in Detroit, my asthma wasn't that bad, and like what was happening to me when I moved here? I did research about that. I was curious. I wanted to know, was I the only person? I asked my neighbors. So because we are all people in this fight, because we are all affected by it, it's kind of up to us to do that individual research, to ask our next door person, to find out, well, who are the people like Miss Landrum who are doing the work to save your life, essentially, and reach out to them and just say, hey, how can I help? I don't know if I know all the jargon or anything, but can I help you sign a petition? Can I help you pass a couple of petitions? Can you explain something to me even further? Because I don't understand. Because sometimes too, in a community like this is Black and brown people, we have other things going on that we can't focus on this issue. So now it's finding a way also as environmentalists to connect the issues together, so people can say, okay, COVID, environmental issues, those are two connected things, and providing resources for people to mitigate those things within their own neighborhoods and communities.
Perfect. Research, make sure that you connect to your neighbors, connect to the organizations. Teresa, very quickly, what are something that you think people can do right now?
I really think that people should get involved with local organizations that are addressing the environmental issues that impact their community. And one of the ways they can do that, as Ms. Arata mentioned, we have to look at our children's health. We have to look at the cognitive skills of our children. And if you notice, if you look at the stats, in many of the Detroit public schools, we have a high rate of learning disabilities in our children that can be connected to the environment. So you have to, when you move into a community, what you're looking for good schools, parks, and things of that nature. Well, then you should also pay attention to what kind of industry is around your community that may have an impact on your health. But we have local organizations like MEJC, we have the Sierra Club, environmental organizations that are putting community and communities' health first.
Wonderful.
So you have to become involved. And also you have to be have the nerve to address this with the city administrators, in which we have done through the health department and working in conjunction with the health department officials to identify and help communities such as mine. We work with city council,
Teresa,
we work with the state and federal. Thank you.
Teresa, thank you so much. That's powerful. And I'm really hoping as families and our community is listening, that you're grabbing this information. We would love for you to make sure that we have your contact information. In fact, if you could just put that in the chat, because we want to make sure, folks, this is our opportunity. We need to be active in as many ways as we can to ensure that we are knowledgeable and that we are working from a place of power, and to do that in a coalition. I'm happy now to continue our conversation and our focus on health, and particularly the reality of COVID. And I'm going to ask Rajeshri if she would come back with us, because we have some of our physicians who are with us to talk about the key questions that we have at this point in time. Rajeshri.
Thank you, Jametta. Could I invite Dr. Boyle and Dr. Ball, please turn on your cameras and your microphones. Welcome to our town hall. We're very happy to have you here today. I'll introduce Dr. John Boyle. He's a pediatrician, board certified pediatrician who's been practicing in the Metro Detroit area for over 20 years and currently is in private practice at Pediatric Care Corner. Dr. Amit Ball is a board certified emergency medical physician who also leads the emergency ultrasound efforts at Royal Oak Beaumont. So welcome to you both. We're so pleased to have you. We're going to jump right in because there's a lot of questions. We've already gotten some from the audience. So I want to make sure we include as many as possible. First of all, you know, Dr. Boyle, you're being a pediatrician, and Dr. Ball, you're being in the ER. I know you're going to sort of overlap on some of these, so we'll kind of just take it as they come. But one of the first questions that has come from our audience is, you know, as we get into warmer weather, is there a safe way for students and kids to be outside and play sports? What do they need to do to be safe? So Dr. Boyle, maybe you want to start with that one?
Yeah, I mean, you're going to hear, thanks for having me, by the way. You're going to hear a lot about, I mean, we're talking about wearing masks, trying to distance, hand hygiene. One thing we're trying to tell as COVID fatigue continues, we're trying to tell our athletes, students to, you know, if you're not feeling well, make sure you check in with your doc, get tested, because that's an important piece too, to keep your team healthy. But what we're finding is, you need to, if kids are going to choose to participate in sports, athletes are going to choose that, they're going to have to look at the risks. Each sport kind of has different risks, whether it's a more distanced versus close contact, wrestling or basketball versus singles tennis. Are they sharing equipment? The time the athletes are in contact with each other, is it an indoor versus an outdoor sport? How many athletes are involved? These are, how well these safety rules are being followed. Different sports and different communities kind of do things differently. So by assessing that, that's going to be important for each athlete to kind of make decisions about sports. Know that, Michigan has implemented that athletes 13 years and above are to get tested weekly now if participating in sports. So that's important to know. And then once they kind of figure out these risks that are there, then they have to kind of weigh the benefit of, how this is going to, obviously we know that sports and activities are good for kids' health, physical fitness, socializing. And then once they kind of weigh those risks and benefits, they're going to have to figure out, each family has, whether they have a child with chronic disease or a multi-generational home where there are at-risk individuals in the home, that's going to help them make that decision whether they're going to participate in sports right now as the numbers are where they are.
Right. Yeah, that's a lot to consider. And you're right, the sort of type of sport, the physical contact, those are good variables for us to sort of remind our audience to sort of think about as you're making your analysis. Dr. Ball, what are you seeing in the ER? I mean, what kind of patients are you seeing? Who's coming in? We're hearing, anecdotally that it's younger people, but tell us a little about the profile of the patients that you're seeing come into the ER.
So, well, first of all, thanks for having me on. I appreciate it. So in terms of your question about who we're seeing, I think it's a wide spectrum of patients still. So certainly the pediatric population, infants all the way through adolescence, and then of course beyond middle age, adults in their 20s, middle age. We're probably seeing a little bit less of the geriatric population with COVID at this point. Also, the way the rollout of the vaccines went, the geriatric population had basically had access to the vaccines a little bit earlier. And I think that that's playing out in what we're seeing in the hospital as well. So in my emergency practice, we're definitely seeing less of that age group that's been infected with COVID. And, prior to this most recent surge, it was really the geriatric group that was the highest risk. Certainly, I think what we're seeing now, there are certainly some patients that are acutely ill, severe COVID, and they're younger. So it's that middle-aged population that we're definitely seeing is there's an uptick in severity of illness, and the hospitalizations in that group, the potential for ICU care and even mortality. I think we're seeing that, which is different than the other surges that we've had.
All right, so it sounds like, if I'm understanding correctly, some of the who you're seeing has to do with both lifestyle and whether or not they're vaccinated, because it sounds like the population where we've seen vaccinations permeate through a larger percentage are not necessarily the bulk of the patients that you're seeing. So questions that has come from the audience is, if you are getting the vaccine, is there any other vaccine that you should stay away from between doses? So say you've had one dose of a vaccine, is there anything you should not do between that dose and your second dose in terms of, maybe they mean like the flu vaccine, or, what should we be doing between the two doses, or not doing, I should say?
Well, I'm not sure if I'm answering this in the context of the question, but one thing to do for sure is not to assume that you're vaccinated once you get the injection or the shot. It's depending on the vaccine that you're getting, it's a 6-week at least process to become fully vaccinated. And so we need to account for that, because we are also seeing an uptick in patients that have received a dose, for instance, and then they're ending up being COVID positive. Well, the vaccine's not going to work the minute it's injected. So that time period becomes critical to do things like social distancing and masking. At the end of the day, what vaccines are going to do is it's going to make us comfortable so we can engage in those same type of human interactions that we previously did. And that's all great, but we have to do it in an appropriate fashion. And I think that at a minimum, the understanding that the injection doesn't equate to being immunized. And so you have to wait that time period. So practice social distancing, sanitizing your hands, avoiding large crowds. So the basic things that we've been doing since the beginning of the pandemic still apply for folks that are vaccinated or looking to be vaccinated.
That's a very important reminder. Dr. Boyle, since you see a lot of kids, where, the patients that you've seen who have COVID, where have they gotten it? Is it spreading at schools? Is it spreading outside of schools? How is it spreading?
I would say probably the majority. So, 80% plus of the positives that we get in our office, we're hearing from that the child has had contact. Usually it's family members, siblings, parents, aunts, uncles. That's been mostly what we've been seeing. Interestingly, there's been some recent studies that have, there's one that came out of Wisconsin looking at the school district there, and they're looking at rates of COVID and how it's being transmitted. And they found that, the actual, if they're comparing the rate of COVID in the school compared to the general population, it was actually 40% less in the school, looking at students, staff, and teachers. And then when they dived deeper into that, they were able to find that and the children that got COVID, only 5% of the kids that were positive for COVID in that school were it was from school to school transmission. It was actually outside of school. 0% in this specific study showed that for staff and teachers, 0% in the school. It was all outside of the school. So we're definitely seeing, it's not saying that you can't get COVID in the school. I think it just tells us that, the mitigation efforts that we're seeing, that the CDC is recommending that schools do, and if the students, and the schools kind of go along with those mitigation efforts, they're seeing some success there.
Yeah, that's what it sounds like. It sounds like maybe we're letting our guard down, our mask down, if you will, a little bit more outside of school. Whereas at school, we're pretty strict, right? I mean, I can attest to that. We're pretty strict about, following those guidelines. So that's a really important message for our listeners as well, that, schools seem to be safer because of these mitigation efforts. And it's probably would stand to reason, as Dr. Ball said as well, we keep these mitigation efforts up outside of school, and maybe we can start to see, reduction in numbers as well. Any news on the vaccine trials for kids? I know that students 16 and over are starting to get vaccines. In fact, some friends and family have very joyfully posted their pictures of them, kids doing that. What about for our younger kids? Any news on the vaccine trials for young kids?
Yeah, we're still, I get that question. I can't tell you how many times a day. And it's, and I'm also a father. And so I'm looking at that myself. The data is still, we're still kind of waiting. Right now it's positive what we're seeing from the early data for the trial of the 12 to 15-year-olds. And it's going to be that challenge that we all, and it's going to be a personal decision where we have to look at, because that age group, the 12 to 15 group, for instance, in this case, the risk of severe disease is small. So we're going to have to really make sure that that vaccine is safe, because we're going to be giving it to healthy children. And, so that's going to be the thing that we're looking at right now. It's looking very positive, but, I think we're going to have to, unfortunately, continue to wait until mid to late summer before we get, all the data. And then we can, give better recommendations.
Okay, great. Keeping on the vaccine question, and then I have another question about the ER specifically, but questions come up about what sort of comes next with the vaccine. Do we anticipate having a booster shot? What do we think comes next?
So I can give a stab at this one. So I think that's a very concrete possibility of us requiring a booster shot. So it's with all things COVID, we're always learning new things. It's day to day that the information changes, and quite honestly, it's even hard to keep up with a lot of this, even as a medical professional. But we are finding that immunity probably does wane. And so this is going to be one of those things that, are we going to be able to eradicate COVID? I would say, from what I know, that's probably unlikely. Is it going to be part of, or just endemic to what we are going to come to know? I think that's going to be more like a flu-like type of an illness, where we're getting annual vaccinations and to kind of give us that immunity that unfortunately will wane. It's incredible that we have, we're a year into this, and, 8 months in, we saw several variants pop out, and now they're all over the world. There's different types of variants. So the disease is unfortunately very smart. The virus will mutate, and it's something that I unfortunately think that it's going to be part of life. Doesn't mean that we can't evolve and learn to live with it. But I think it's something that's unfortunately going to be part of our reality.
I think it's just, as you said, it's something we just have to sort of become accustomed to living with. It just takes us time to get there. But question for each of you, and maybe you can answer from your respective positions. When should we be seeking medical care, right? So when should we bring our kids to the doctor's office? What kind of symptoms? And when should we be elevating it to come to the emergency department? So Dr. Boyle, maybe you can start with the pediatric sort of a take on that. And then Dr. Ball, you can talk about the emergency department.
Yeah, we're recommending at this point, kind of the same recommendations we would have whenever your child is sick. If they have a fever, you're treating the fever at home. You're looking for signs of respiratory distress. They're having trouble drinking and keeping fluids down and dehydration. So they're looking for symptoms that would be concerning to bring them to the doctor. We always say reach out to your doctor, give them a call if you're concerned. And then at that point, we're seeing them here in the clinic. Because of the COVID, we're definitely testing. And in pediatrics specifically, the way it's presenting is maybe not as classic in the adults. We're seeing more GI or stomach symptoms, and it's we're seeing more and more studies. There's another one that came out on the West Coast, 30% plus are asymptomatic, meaning that kids can have very minimal symptoms and have COVID. And it's important that they seek medical attention a lot of times because we're trying to figure out, if they have it, and then to be able to contact trace and kind of protect others. Because thank goodness, for our age group that I take care of, COVID has been less severe, and that's been a positive thing in pediatrics.
Dr. Ball, when should we be coming to see you in the emergency department?
Well, hopefully we can kind of keep that number down, but I think really the take home is some of the symptoms are subjective, and when we talk about severe COVID, oftentimes it's in the context of a severe respiratory illness. So where you're not getting enough oxygen into the body and are having difficulty breathing, and those would be the main reasons that patients are admitted into the hospital. But some patients just have significant or severe dehydration, or they become altered in terms of delirious and so forth. So there's a wide variety of presentations. Certainly, I would say the first step is connecting with your primary doctor, and COVID's been a very innovative time. So there's plenty of options for patients. So whether they're other acute care type of settings beyond the emergency department, or virtual visits and so forth, there's opportunities to connect with your doctor. Obviously, if somebody's in severe distress, the emergency room's the right place. I'd also recommend use of portable pulse oximeters. Can be very helpful, because when you have the disease and you're coughing and you're having difficulty breathing, then the question is, okay, well, what's tipping me over the edge where I need to go to the emergency room? And sometimes that can be a nice objective measure.
Is that something we can get on Amazon?
Yes, you can.
Okay. Say it one more time.
One thing I wanted to mention, I may not have mentioned with regards to the athletes, if they do have COVID, there's newer recommendations out there that definitely have them follow up with their pediatrician or primary care doc prior to restarting athletics. There is some screening that needs to take place depending on the severity of their COVID illness. Those athletes may need some testing, maybe referral to cardiologists. And then what we're doing is a slow return to play over time after there's a delay between the illness and return to play. So that was just one thing I wanted to mention, that for children who've been, and athletes specifically who've had COVID, make sure they're reaching out to their doctor prior to getting back into athletics, because there's some things that need to take place.
Great, thank you. And Dr. Ball, you said that was a portable pulse oximeter? It's a mouthful. Yeah. Okay, well, we will write that down and make sure it goes in our website where we list all the questions. We have a ton more questions, but not a ton more time. So we want to thank you both for being here. As always, we're committed to getting all the questions answered. So we will get them, send them out, get them answered, and post them to our website. Jametta, I'm going to hand it back to you. And
okay.
The next place. Thank you again, doctors.
Thanks.
Yeah, that was a powerful amount of information. Thank you so much. And I hope that our parents that are out there have had their booklets, because we have to really make sure that we're listening to our experts, because the information does change. And so knowledge is power. And as we talk about information changing, some things really haven't changed. And that reality is that as we experience trauma, as we experience loss and grief, our souls sometimes have a lot of difficulty handling that. And unfortunately, we know that we have to really focus in on our mental health. And we have to face the reality that we are having some increases in suicide, particularly amongst Black and Brown children. And to help us to think about this and have some conversation, we're pleased to be able to have Nancy Bill, who is from the School of Safety and Student Assistance. She works as a consultant with Macomb Community ISD. And also Frank Blackman Jr., who is a junior from the University of Detroit Jesuit High School, to have a conversation with us about the realities of mental health and what we're witnessing in terms of suicide. So Nancy and Frank, welcome, and be real happy to have you give a bit of your overview, and we may have some questions as you go forward.
Thank you. Thank you for having both of us here. And I'm glad to be partnering with Frank, because in the very beginning of this, you had talked about the importance of hearing from our youth, and they're going to be our future. And so I think we're in for wonderful input from Frank. And I would just like to say, in starting this, that the time of COVID, 13 months into this right now, our nation, the world, has been through this unprecedented, very catastrophic crisis event that started off really acute, and now we're moving into a chronic crisis event. It is completely unexpected. It's very significant losses that we're experiencing that are tied to mental health challenges and mental health struggles, and in fact, suicide. We have to cope with and move through loss of loved ones through this pandemic, the loss of ability to be out and about. So in a sense, we're contained and we're confined, and loss of our connections. Connections are so vitally important to us as we look to grow with our positive mental health and look to prevent suicide. We are beings that are built to be of service to one another. We are hardwired to connect. And we have a term out there now being called social distancing, which I think is, I've started to use physical distance. We need to physically distance, but find a way to socially connect in this time. And I'm going to throw it over to Frank in a couple of minutes, but just to say that the issue of suicide and becoming aware of the challenges we're facing in suicide prevention, it's not something new that is brought on by the COVID time right now. I've been doing this work in suicide prevention, postvention, intervention for more than 30 years. Suicide in our youth has always been the third leading cause of death for youth until about 2005-06, and then now we're saying that it is the second leading cause of death for our youth. And for many, many years, I was able to do trainings and say that for Black individuals in the communities of African-American Black communities, it was a protective factor, because the suicide rates were traditionally lower than that of white or other American Indian, and even Hispanics are attempting at a higher rate. But now we do have to pay attention to the fact that we have startling increases in the Black community for suicide. So that was something that started before COVID. Now, as we look at data typically is 2 years behind, but completed suicides have seemed to have gone down slightly over the last year. But, and I don't know if our ER doctor is here, I was hoping to try to find out. What I'm hearing anecdotally, and I'm no medical doctor, is that while the actual incidence of suicide right now during this pandemic appear currently to be down, we might be seeing more significant attempts. So people attempting suicide and finding their way to an emergency room and needing medical intervention, it is on the rise, while the completions are not. So I'm not sure what's going to happen traditionally after a pandemic or a big crisis like this. Our rates go up. But I want to throw it over to Frank and just hear from you, Frank. What are you seeing as a high school student? What's your experience?
Yeah, so Thank you for the introduction, Ms. Buell. So yeah, like she said again, my name is Frank Blackman. I'm a senior at U of D Jesuit. My work in mental health began in 2019 when I was, faced with 3 tragedies from students at our school, all by suicide. And so I understand firsthand like the things that kids go through, and I use my voice to help other kids who struggle with mental health issues get help and seek therapy. So currently what I'm seeing as the pandemic, is kind of a lot of ups and downs, and you're kind of unsure really about everything that's going on. And so I think overall kids are just kind of lost in translation a little bit as far as, how to function. What to do, is the pandemic going to be over soon? Is it not? Are we going to be able to go to school next year? And we've seen a lot of this, even with kids that depend on, DPS to go to school. We've seen a lot of ups and downs with that as well. So I think that, kids just don't have a balanced life as they're accustomed to. And I think, I've talked to a lot of kids, especially in the minority communities, just talking about how, their parents went from being at work 2 jobs every day to their parents not having any job at all because of COVID. And so I think it's a big, kids are just trying to understand everything that's going on. And I think it's a huge disconnect between, the parents and the news and what everybody's hearing. And I think kids are just kind of not nervous or afraid, just kind of trying to figure out their way in this world, in this chaotic world, to say the least. So.
It is
if I may, thank you so much. I just wanted to thank Frank, and then Nancy, let you know what we'd like to be able to do if you would go with us on this, because as always, we have so much information we're trying to provide. May I ask 2 questions that we've had that come through to the 2 of you, and then we'll need to move up past this segment. So one of the questions is, if from your various perspectives, what can parents and Frank, you do right now if you are feeling or either witnessing someone who you think needs the benefit of help right now? What are the signs that they should look for, and then where should they go? And how about I ask Nancy, and then Frank, if you would, from your perspective. Nancy?
Okay. So we should be looking for things that are out of character from what we would say is typical of your loved one or of your youth. So this would go for youth as well as adults, but something that is out of character. If they're isolating more, if they're more irritable, if they're using substances now that you're pretty sure they weren't using previous, if they've had just lots of crisis events that seem to be piling up. And one thing I'll say is we look for an increase in pain, pressure, and problems. That's just like a nice, easy way to say we need to start asking a question. We need to start looking in and opening up our lines of communication with our youth. I say also look for anything that they may say or may be saying in their behaviors that would lead you to believe they're feeling hopeless, helpless, useless, worthless, or powerless. And those are key points to be paying attention to. And then we just need to ask the question, I noticed that you're acting this, that, or the other way. I'm concerned. Are you, tell me what's going on, and then just come directly out and say, are you having thoughts of suicide? Frank, from your perspective, what do you think?
Yeah, I think for anybody, teachers, parents, counselors, therapists, anybody that is around kids on a daily basis, I think the most important thing is just to notice what they're going through. If you notice a kid is starting to isolate themselves, don't isolate yourself from that kid. You have to continue to be open to conversation, like Ms. Buell said. So I think that's the most important thing, is just noticing. And it's extremely hard to do that with the lack of social interaction, but just, continuing to check up on kids at all times is the most important step. And then you can start inviting yourself to a conversation after that. But noticing signs, starting to educate kids about mental health is very important during this time.
And I would add too, because we know that people will hide this internal despair. This is a complicated subject. We have only a few minutes, right? So what I would also say is reach out for more training. There are trainings going on all around your communities on more intense suicide prevention training, but know that an individual who is thinking about suicide may not be able to say out loud that they're having this despair, that they're having this darkness, this cloud over them, and they can put on that face of still continuing to interact. And so while we're talking about looking for signs, it does not fall, I'm not ignorant to the fact that there are many people who will attempt and or die by suicide, that it is shocking to all of us. Like, I didn't see it coming. They were happy. Yeah. They seemed to be coming out of that typical isolation. So here's what I can say, whether they're showing signs or not, is just open that dialogue, as Frank was saying. Just start to communicate about the importance of being mentally healthy. And you can say, I've been hearing a lot about teens who are struggling with thoughts of suicide. Have you heard of that in any of your friends? And what about you? You can just open that dialogue. It's hugely important.
This was wonderful, and our apologies for cutting this segment in particular short. I think I can say on behalf of all of us with the coalition, this is a conversation we've been wanting to have, and we want to have you back. Your words resonate about how we mask. So in the time of COVID, there's lots of ways that people are masking, and we mask our social, emotional, and mental states so often. Again, thank you, and thank you, Frank, for your advocacy with young people.
Frank is going to be joining us with a lot of you up on the screen right now, because this will be a more in-depth conversation for everybody to take part in, which I think is hugely important. And thanks to Detroit Public TV and the WEDA group for putting on a Wellbeings Tour on April 28th, 7 p.m. It's going to be a live show, and Frank and 3 other youth are going to be talking about this important mental health issue.
Awesome. Awesome. We are looking forward to that. Thank you for sharing this information, and we'll continue to share it too. But another way sometimes that we can work on our mental health is to get up and move. And one of the folks that always is so precious to us, literally, in this time and space of trying to deal with our spirit and our mind and try to figure out how we bring that all together, is Kimberli Boyd, who is a yoga guru, master teacher, and joyful person to work with. Kimberli, it's been a while since we've seen each other. I'm ready to stand up and do some moves. So let me hand it to you, please. Would you close us out with how we can center and exhale and breathe in this time period? Kimberli Boyd.
Absolutely. Thank you so much, Jametta. And it is beautiful to see you again. Welcome, 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 everyone. So the word that I have for our inspiration today, we've heard several times already, connection, and particularly today on Earth Day. And yoga, which is an opportunity to connect to the thoughts of our mind, the movements of our body, and our breath, has lots of beautiful inspirational images and ideas that will do those too. So I invite you to practice where you are, meaning to remain seated if you like, or stand if you will, as we practice feeling our connection to the earth and to one another. So, as I would say to my children, chicka, chicka, boom, boom, I'm gonna give myself some more room, move my camera back so you can see just a little bit more of me, right? And let's have the first connection be our hands to our heart. So I invite you right where you are just to place your hands, one or both, in the center of your upper chest, and simply take a breath in gently through your nose and blow it out peacefully through your lips. And repeat that a couple of times as we consider that the breath is the wind that is causing everything to move and to grow around us. The next inhale, I invite you to reach your arms upward and connect to the sky. And not just connect with your arms, but look up. And I invite you to just reach and stretch in whatever way feels good to you. And think about, what are you connecting to that is inspirational to you? Whether it's a word, image, idea, person, or thing. Look up and give yourself a chance to really connect to that which inspires you. When you're ready, take another beautiful breath in. And as you blow it out, simply allow your hands to float back down to your heart, reconnecting to the beating of your heart and the flowing of your breath. The next connection I invite you to is to reach your arms wide from side to side. And the thing about being in Zoom is you can look from one side to the other and kind of see who you're connected to. And so right now I invite you to just simply reach and stretch your body gently from side to side and consider who is next to you in the Zoom room where you are, in the community that you serve and live. Be connected and know that this connection is there for you if you need something. So if you need something, reach to who's next to you. If you have something to give, reach and share what you have as we simply move our bodies gently from side to side and come back to the center. Take a breath in and breathe out. As you exhale this time, I invite you just to let your eyes look down, allow your body to soften and maybe fold gently forward. And notice that you may be looking at the ground, at the earth itself. And for a moment, just lift and lower your heels and allow yourself to connect to the idea that even when everything else seems to be unstable, we have this amazing earth beneath our feet, offering stability, offering gravity, offering literally a place upon which to stand. And so with your next inhale, press your feet against the earth and reach high into the sky again, using the solid strength of the earth to reach and reconnect to that which inspires you. Take another breath in, bring your hands to your heart. And now if you look down, I wonder, can you bring your two thumbs together? If you can, you may notice that it looks like your heart has wings. And so from this place of stability and peace, I offer you that we are strong together. Be connected to the earth, be connected to the breath, be connected to one another. And from this place, peace.
Thank you, Kimberli, as always, keeping the connections. Rajeshri, it's all yours to close us out as we focus on our power and keeping connected.
Absolutely. Thank you to everyone for joining us today. A special thank you to all of our experts and guests, and for all those who are behind the scenes making it happen. We appreciate you. A couple of announcements. 482 Forward, a strong partner in this coalition, has launched a community voting tool for each school district in the state. It allows folks to take a look and vote on how they would want the school stimulus money to be spent. If you take a moment to check it out, and it's available at michiganjustice.org/community voting. And we'll put that in the chat as well. If I could ask one of my colleagues to please put that in the chat, I'd appreciate it. Detroit Parent Network, Week of the Young Child, celebrating powerful parenting with advocacy and health workshops, and Family Day with vaccine and testing at Detroit Parent Network on April 30th, virtual and outdoor. So please join us for those events. We are also asking you to nominate a teacher that we can celebrate next week. Please fill out this form, which will also be put in the chat, to nominate a teacher that has been a support to you throughout this year. This is one way for us to show our hardworking teachers how much they're appreciated. And lastly, I wanted to just read you something that Dr. Ball sent me after he left. He said, the one thing I would stress is that vaccinations are very important. For anyone on the fence, it's good to look at the Israeli data. Best in the world, with over 50% of their population vaccinated. They've had a sharp decline in hospitalization and severe disease. As a nation, we are at 30% fully vaccinated, and we need to do better. Vaccines are available readily, so we don't have a supply problem. So we encourage and urge everyone to get vaccinated. And if you still have remaining questions, to talk to your medical professionals to get them answered so that you feel comfortable doing so. All right, if I can please ask the rest of my team to turn on their mics or turn on their video. Thank you for making this happen. We appreciate you. and stay powerful. Thank you so much and have a great day. Bye-bye, everyone.
Bye-bye.